You're listening to Med School Radio, coming to you from Central Tokyo. Today I had the opportunity to talk with Dr. Ingrid Herrmann, who is a medical school professor at 2 medical schools, including Oceania-University-of-Medicine. And this was just a last-minute informal questioning. I was just interested in learning her opinion about a few things. I asked Dr. Herrmann how medical students can prepare for a class in microbiology and how medical school professors might ask questions to students regarding the material.
I think it depends on the student's background. Have they had a recent microbiology class or not? But just that repetition through, for me, it was looking at different review books, at the way it's said in different ways, looking at different pictures. For some students, I've noticed that looking things up online would stimulate that repetition or the sinking in of that material.
So you're saying that it's okay to look at a variety of resources?
Yeah, and some students, unfortunately, will get overwhelmed by a variety of resources, but if they're not understanding it the first time around by looking at, let's say, the instructor's PowerPoint notes and by doing textbook readings, then for sure they want to consider looking at review books or looking at, websites. In fact, I just emailed my current microbiology class a list of websites that we offer to the students here at the local medical school where there's free information so that students can just go to different sites and looking at pictures. And that seemed to me for repetition, because for some reason it was very boring for me to go through the same PowerPoint, let's say 5-6 times. That just killed me. It just bored me. And so I'd have to be stimulated by different, review books that might have a different way of saying it. Or
I see.
It's just different ways of explaining it. So you're not just limited to the textbook, but it gives you more creativity and lesson planning to show additional pictures and materials to help be an effective instructor.
I imagine it's a very important thing to be interested in the subject that you're teaching. Have you ever lost interest in the subject that you're teaching?
I don't know if I've ever gotten quite to that point. Maybe it's because I like to change things up a little bit all the time.
I remember that you had suggested that we use the Lippincott Microcards for your class that were very helpful.
Oh, the Microcards, yeah. And I was just using them recently, and the students loved them. And I told them that these cards have been looked at by many, many experts before they were published. And the case studies they use on each of these microorganisms is considered the most classic case that you may see on that particular microorganism. So we were using that actually during our microbiology review last night, and they really appreciated them because it also gave them a standard to which they know they have to step up to when they're getting ready to take the USMLE Step 1. So that gives them and I even told them we're going to go through these cases from the microcards. I know they're going to be more difficult, but let's go ahead and look at them and try to pick apart these cases. Can you pull out information that would make you think it's this fungus or this bacteria or this virus? And so we were just practicing with the cases. So that's another way to evaluate or analyze the material, because with the Blooms Taxonomy triangle, when instructors are making test questions, they always want to go as high as possible on that Blooms Taxonomy triangle, because at the very bottom is just recall, but as you get to the very top, you have evaluate and analyze, and if students are able to do it at that level, then they're better able to retain it, and they're also hopefully better, prepared as they're studying for the board exam.
I'm sorry, can you explain a little bit more about the Blooms Taxonomy?
The Blooms Taxonomy is actually a triangle that shows you the level of order of questions as far as when an instructor is making a question, and if I don't know if you can pull it up or do a Google search. And so we're always trying to, with medical students, at least in, graduate medical education, we're trying to ask a higher order question that analyzes, evaluates critical thinking versus the lower part of the pyramid, which is just recall, which is not is not as exciting to learn, but it might not stay in your long-term memory as well.
Well, thank you very much, Dr. Herrmann, for taking the time to talk to me today about microbiology and how you ask questions to students. And we look forward to asking you more questions in the future, if you don't mind. Thank you very much.
Sounds good.
You're listening to Med School Radio.